Good afternoon. On Monday night at the board meeting, I presented the latest data regarding COVID-19. Because we were at the 14-day mark to move on to the next phase, it was important to share with everyone, the board and our residents, that data. Here is that presentation. So I'm going to give, before we go into the summer special events that you asked for COVID updates. I'm pretty much the guy that gets all the data and puts it all together, so Ahmad collects it all on a daily basis. Give you some idea of how challenging that is. The reporting of it changes, every couple of weeks, what they report, how they report it. So some things that we were tracking and really getting good information from suddenly disappear. Then something else pops up and you have no history on it. And a lot of the stuff that they report, they'll report on a daily basis for a period of time, and then they change all the numbers for the history, and so Ahmad has to check all those numbers every day and make sure that, and then change them again if they recast the numbers that they've had. And then a lot of stuff is reported only daily in total, so the only way to get the daily numbers is to capture it every day and then figure out how much the increase was each day. So it's a bit challenging, but taking all that information together, Ahmad puts it all together, and essentially that's where these slides come from. So I just want to remind everyone, I know we've talked about this a lot. We go back to my first meeting with, which was put together by the city of Chicago and Dr. Arwady from Chicago and CDC, and they talked about 4 things that they look at whenever there's a pandemic: morbidity, which they said there really is nothing they could do because there are no cures. They said if we happen to find a cure, it'll change it, but there's really nothing they could do for that. Spread, they also said at that point in time that there's not much they can do to stop it. It was going to be a pandemic. This was well before it was called a pandemic. They said the cat's out of the bag. So they said what they're really concerned about is slowing the spread and smoothing it out so that it protected the healthcare system. Because if the healthcare system gets overrun, then you could see death numbers increase because some of the other conditions wouldn't be able to be cared for because the healthcare system, they couldn't get seen. So they were really worried about number 3, and then they were also worried about the economic damage. And so, as they pointed out, they were really trying to balance at that point. This was back around March 15th. They were looking to balance the healthcare system versus the economy. Because obviously, we've talked about this before, a poorly functioning economy, you can't really provide very good health care. So, and a lot of things, as we know, have gone up: suicides, depression, mental health issues that we've had to have calls for, domestic batteries up, all those things that happen when the economy is doing poorly. And obviously, it's as poor as it's been since the Great Depression with everything. So they're trying to balance those things. So what are we in? We're in the position where we're trying to reopen the economy safely. We didn't overrun the healthcare system. The healthcare system is now in fine shape, and we need to just make sure as we open that we don't cause the healthcare system to not be in that position. So that's what this is about. So flip to the next slide. This, although it only goes to July 2nd, because that's the latest data they have, the University of Washington looks at they have a lot of models, but one of the things they started looking at was the mobility of different areas, how people are moving around. And they track that generically through cell phone movements. And as you can see, near the end of March was the low point, or is it minus 55%? That was after the initial lockdown. People were pretty much locked down, closed, and then you can see it gradually started to trend upwards as things were open. Then it trended upwards some more. Currently, for the entire state of Illinois, it's about minus 20%. I would contend it's probably much higher than that in Orland Park, because Illinois includes Chicago. There's a lot of people still not going into Chicago, and Chicago's still a little bit more locked down than other communities. So at least from what I've observed on LaGrange Road and everything, I think it's probably higher than this. But keep that in mind. There's a lot more movement, a lot more activity. I don't think that's anything surprising to anyone in here. Even with essential businesses, we may have had 20,000 people, but the LaGrange Road was fairly empty. Now it looks like it normally does, and it's packed. So here's the numbers that we've seen. So cases in suburban Cook County have trended down. That trend line's from PowerPoint, so it just fits it in there. Trend line's down. You see there's 2 days here where cases went up in the last couple of weeks. One of the problems is that their testing has gone through the roof. Back in the early days, like the 5th of April, we're testing maybe 8,000 people a day. Now they're testing 40-some thousand plus. So as I've always said, cases are a difficult number to really judge because it can kind of be manipulated. They don't report. In some of the cases, you see that they didn't report for 2 days, and then all of a sudden there's a huge spike after they didn't report for 2 days. Well, that's because they didn't report anything, and they reported 3 days worth of stuff in 1 day. So we see some of that, which gives you some anomalies. But nonetheless, it's still trended downward. It's kind of flattened out here more recently, which is not surprising because we've opened up more. The one that I really look at is hospital admissions, because at the end of the day, we're worried about protecting the hospital system. And the hospital admissions in suburban Cook County have trended down since the end of April. And as Ahmad could tell you, that these numbers do change, and so these reflect the latest ones from today. They constantly go in and update these things because they do it based on report date. Sometimes they get reported later. But as you can see, there's been a steady downward trend for a long time, and now we're down into the low single digits as far as daily hospitalizations across all of suburban Cook. Because even if we tomorrow had 500 cases, if only 3 people are ending up in the hospital from those 500 cases, you're finding the asymptomatic cases that were never tested before. In fact, we know back in early April and May, certainly April, that people that were sick, that had all the symptoms, they said, do you run in a high fever? No, not really. Well, just monitor it and stay there. You probably have it, but they didn't even send them for tests. They just assumed they had it, and that was it. So now they're testing, as you know, anyone can walk up and get a test. So you're seeing it way more testing. And still you're seeing hospitalizations, and that's really what we're worried about. We're worried about making sure the hospital system's not overrun. So that's continued to trend downward. COVID-related deaths in suburban Cook County, now as I've talked about before, this is a lagging indicator. So it does trail a little bit because obviously they go into the hospitals usually before the worst happens, and they're there for a while for that. But even that, you see that the numbers have trended down in suburban Cook County and even statewide. But focusing on suburban Cook County, why? Because that's the information that we can get. So as you can see, that's also trended way down and it lagged back to, we peaked probably the end of April. Deaths peaked a couple weeks later than that, which kind of makes sense. So, but still trailing. So ICU bed and ventilators, again, we're worried about the healthcare system. That's continued to trend downward and has flattened out a little bit, but it's very low compared to what it was at its peak. Its peak, it was 1,250 ICU beds, and now we're right around 300. So much less as far as COVID patients in the ICUs. It's not really straining the system at this point. This is the availability. It says on the right here, 14% threshold. Actually, the governor announced new thresholds of 20%. We're still way above that in the southwest suburbs. So 80% ventilators, ICU beds are about 35-40%. So we're well above that, and so there's plenty of capacity in the hospital beds. My last phone conversation with Dr. Arwady in the city of Chicago is she said right now they could handle a massive flu outbreak at the current caseload. So, the system could still handle that. So they're feeling pretty comfortable that they're in good shape on that. So this is the metrics page that, if anyone has been going to that page, I don't know, it popped up, about a month ago, 5 weeks ago, they started showing this metric page and whether you're in the green or not. And this is for the Northeast region, which includes Chicago. And this is last week. This was, I think, as of last Thursday or Wednesday. Well, they don't report that anymore. So even though we've been watching this same graph for 5 weeks, this is one of those things that now it's not reported anymore. But this is what it was last week. So to give you an idea of where everything looks as far as surge capacity, our positivity rates in the region, et cetera. So pretty good. So now they have a new metric page, and we are in Region 10. So back to what all of us, at least one time, sent to the governor and asked him to break it into separate regions, and most of us many times said, hey, we should be using the emergency response regions, the 11 emergency response regions. Well, last week, near the end of the week, the governor said he's going to be using 11 regions. He's not using the emergency response regions. I'm not exactly sure why, because at the end of the day, we already report all these hospital things by emergency response regions, so now they have to be reported in a different way. So I'm not exactly sure how that's going to work, but regardless, our emergency response region includes southern Cook County, a little bit of western like Lamont, and then goes down into Will, so kind of the south portion of the suburbs. This region is all of suburban Cook County, so like Mokina is not included, but Evanston is. So that's just kind of, maybe it doesn't make sense, but it's the information that we have. So you can see here, everything's in the green here, and even though they said there's some daily increases in test positivity, those increases are like fractional of percentages, like 0.1, 0.2, they're very small. And the 7-day rolling average, now these are, the important thing to notice here between you'll say, well, that number's higher than the number you saw in hospitalizations before. This is COVID-like illness. This isn't people with COVID. So this is symptoms that look like COVID, which a lot of things do. So the other chart was actually people with COVID, so as it turns out. So just so you can see, but even the COVID-like illnesses are on decline, plenty of medical surge capacity for beds as well. So that's region 10. If you go to the next, that's the southern part of Orland Park is in Will County, and that is part of this, and that is also in the green for everything. So, so you can see that, the area is doing pretty well for the last, in this case, they only had 10 days, so that's the last 10 days, because again, they changed how they were reporting. This is a new chart. So, Region 7 of the South, that's our emergency response region, and that includes a hybrid of both of those last two things that you saw. They still report this, which is ICU beds available, ventilators available. You can see that's 35.6% ICU beds, 85% ventilators, well over the 20% threshold. So there's not really much of a spike on hospitals. The state has also started sharing county level metrics, which are different, and you can see these county level metrics. They all meet the goals. The little warning you see over there, my understanding of the CDC is 100 to 200 is considered moderate to high. Above 200 is considered high. 10 to 100 is considered moderate to low, so we're in moderate to low. These are just 2 days worth of reporting based on the fact that they didn't report for 2 days. Some of the areas in suburban Cook County, there was certainly a spike in some cases because there were 2 days of zero. So based on what I saw on Friday, I think it was less than that, not surprisingly again. So, but still in the moderate to low range, which is what they're actually looking for. But over the last 2 days, they saw a little bit up. But everything, you can see everything there is in the target. So So based on all of that, my advice is we're using 2 weeks. My advice is we move on to the next phase. We let people, continue to use judgment, which they'll do. I don't think anyone is, running around to fully reopen the restaurants, but it'll allow them to gradually do so as they see their customers feeling comfortable. A reminder: long-term care facilities here still represent 54% of the deaths. They are, the case fatality rate's about 16.8%. The cases in nursing homes was about 15.5, now it's like 14.8, so it's gone down a little bit as they start testing other places. We did have one more death in Orland Park a couple weeks ago. According to the Illinois site, that was also a long-term care, so it's 34 out of 35. Average age is about 84. And 97% of those that had serious health conditions prior to getting ill, which doesn't make it any less sad, but it's just, as we know, it's really attacking people who are elderly and already have some illnesses. We've seen this chart before. That really hasn't changed much, and that's through 7/4, but those numbers have changed maybe 0.1% for the last month. Flip to the next page. Cook County, you've seen the same thing. You've seen this over and over again. Half of the people over 70 end up in the hospital. If you're over 80, if you end up in the hospital, there's a 60% chance that you're not going to come out. So again, the elderly population, even as we open up, needs to really protect themselves as much as possible. Stay away from folks. Wear a mask that protects you, not protects others. So wear an N95 or something like that if you can get it. Because that's going to help protect you, especially if you have some other comorbidity. Some other information that I think is important as we entertain, and none of us here make decisions for the schools. So let's make that perfectly clear. The schools make their own decisions. The school boards, the school administration, and anyone who has kids in school are making those decisions. And I think we have a couple of board members that are going to be making those decisions. But it's important to have the information. So from February 1st to July 11th, what you see on this chart is influenza and pneumonia deaths in the various age groups and COVID deaths. And you'll see that for every age group, influenza and pneumonia deaths are actually higher than COVID. So these upper respiratory issues, it's not just COVID, it's not something we don't usually see. We do see this. It's something that is around. We do see it. Now there's just another one besides flu, besides pneumonia, there's another one that's included in this. And if you notice, in particular with kids under the age of 14, there have been, I believe it's 26, I think that's 20 or 31, I'm having a tough time reading it from this distance, but 31 COVID deaths, unfortunately. But there's been, almost 300 flu and influenza deaths, so almost 9 times higher chance of dying of influenza or pneumonia than COVID under 14. 15 to 24, so you get into the teenage years and into college, you're looking at almost double the number of influenza and pneumonia deaths versus COVID. So it's just important to put some things in perspective. The other thing, high school teenagers, 6 of them die a day in a car accident every day. So that's 2,000 a year. So as you're making the decisions for your families, as you're making the decisions for the schools, factor in, there are a lot of risks that are taken on a daily basis. You need to look at this as well and just factor all that into your decision making when you make that. So I just thought that was important to show. And then if you flip to the next page, it does show COVID-related deaths and deaths from all causes. So you say even for 85-year-olds plus, it's about 10% of the deaths. And obviously it's minuscule for those that are children as far as, and that's of the total deaths of that age. And every death of every child is tragic, but the reality is in a country of 320 million people, we're going to have some. So it's important for you to have some perspective. As you can see, the data clearly indicates that we have continued to decline or remained steady on all the indicators required to move on to the next phase. Our plan that was approved at the last board meeting recommends 14 days to move from phase to phase. This follows the expert guidance of the CDC and the WHO. For that reason, we have moved into the final phase of our Back to Normal plan, which is fully reopen. What that means is that businesses are allowed to fully reopen. However, they're still going to have to make customers feel comfortable. So it's still going to be up to the customers and the businesses to determine what are the best courses of action. I still recommend that you follow the CDC guidelines that we currently have throughout the country, which is to social distance. Please stay at home when you're sick, and make sure you're following proper hygiene. Those were the 3 things that got us through the beginning of this. Then additionally, regarding masks, if you are in indoor spaces where you can't social distance, it's not a bad idea to wear them. So consider doing so to make others feel comfortable. So I encourage all of you to continue doing what you've been doing through all of this. Orland Park's done a great job. Thank you very much, and have a great afternoon.